You know what?
What?
Moving forward or moving on, today, how
Ano
about we
talaga?
take a
Forward?
look? Basta onward, forward, pare-pareho lang yan. How about we take a look on our inner self? That's going to be our episode for today. No, titignan natin at magre-reflect tayo.
Inner self.
Inner
Ang
self.
taray nung reflect.
Tamang-tama dun sa last category na sinabi mong anong movie yun?
Inside out.
Inside Out.
Ay, para ding reflection, diba? Look at me.
Ang baba.
Sino kumanta?
You may thank you. Char, ano lyrics?
Regarding artist.
Kaya naman, ipakilala na natin ang ating special guest for today.
Yes, here with us this fine day is Dr. J.M. Chu, a psychiatrist.
Yeah!
Hi!
Thank you for having me.
Kamusta po? How are you?
Mabuti naman po. Sa isang malamig na Monday morning po sa inyong lahat.
Ay, sige.
Afternoon na pala.
Oo.
Yes, and it's very nice then to have kasi we have a resident psychiatrist to talk about mental health states no mga kasi our show is about Poz and
PLHIV empowerment.
PLHIV empowerment.
Yes,
Let's see naman what goes in their head and how we can help them.
Marami din sa actually pinagdadaanan nila.
Actually,
So,
yes. And speaking of mental health, no, Eva and Viñas and Doc, and napag-uusapan din madalas or nababanggit yung salitang mga katagang self-care, di ba?
It's very important.
Yes, it's very important. Most especially kapag ang isang tao ay na-diagnose to being a person living with HIV, no? Ano-anong mga steps ang kailangan nila para na ma-maintain ang healthy lifestyle, and when how can you expound further when it comes to doing self-care for a person living with HIV?
Well, una-una, we have to define muna kung ano yung self-care. Kasi very important yan. Kasi a lot of people always assume na pag sabi mong self-care, ay, puro sarili lang.
Yeah.
Iniisip. No, it's more than that. It's actually, it's not about being self-indulgent or just taking care of yourself, but mentally, physically, emotionally, socially, sa dami-daming aspect yung being, patas kasama yung spiritual rin, di ba? Oo. Yung ibig sabihin ng self-care. So pag sinabi mo kasi self-care, it's actually taking care of yourself for you to actually be better. No? It's not being selfish eh. It's just kung ano yung dapat mong gawin. No, you can actually take time off, you can, leave from work, just stay at home or just do things na you love to do, no, for your mental health, no, kasi yun ang tamang definition ng self-care. Kasi a lot of people say self-care ay baka makeup na.
Yes.
Or
staycation.
gluta-gluta or
Yes.
mga ganon-ganon, but it's more than that.
Yes.
Especially pag if you are like mga post clients natin,
Yes.
no? Kailangan talaga mas wider yung understanding about self-care. Kasi sila yung medyo, difficult, lalo pag once they find out na kung positive sila. Yun ang medyo, may mga stages kasi yan of course. No? So,
Yes.
kailangan talaga nakafocus talaga tayo na ibibigay yung tamang self-care for them.
Doc, meron din ba kayong mga treatments for specialized para sa mga PLHIV?
Yes. So, marami mga treatments yan, no? So,
Rebond.
pinaka
Hindi nyo napigilan yung
pinaka-most common talaga is yung CBT o tinatawag natin ng cognitive behavioral therapy, no? So, ano ito, no? So, it's para siyang tinatawag na talk therapy na sinasabi natin, no? But we have to make sure na once you do that, kailangan make feel mo or i-inform mo yung pasyente na this is actually a safe space for them. No, kasi importante talaga 'yon, no? Yung space na wherein they can actually talk and you listen, and then the ideas and the openness ng isa't isa is nandun talaga. Because kung wala yung feeling na hindi siya safe, hindi talaga siya mag-open up sa'yo. Kasi, of course, there's a lot of stigmas already, there's a lot of fears already, and then sa stage nila, marami talagang gumugulo sa isipan, marami tumatakbo, no? Chances are, iba dyan is hindi pa nakapag-open up sa family, and then ikaw, sino ka ba? Na hindi naman tayo close. No, binayaran pa kita. But pagkatabat ako mag-open up sa'yo. So, you have to make them feel that it's a safe space for them to open up. Okay? So, pangalawa is yung tinatawag na structured counseling. Because, kailangan talaga from the very start, alam ng client mo na ano yung goal ng therapy natin, ano yung mga parameters na ginagawa, anong characteristics, anong purpose, ano yung time frame, no? Kasi sometimes, like I mentioned, no, na sometimes hindi to kagaya ng medical condition na after bigyan mo ng gamot sa ubo, antibiotics, 7 days, 10 days, wala na. Hindi mo na makikita. This one kasi, sometimes you see clients per week. Ako, I usually tell them to come back to me after 2 weeks, no? Every 2 weeks. Or, pag medyo okay na, every month talaga ang ano yan. Because, it's always a process. Wala tayong parang isang tingin lang, konsulta, okay na ako, no? Pwede na ako, I'm ready to face the world. Kaya ng ganyan, pero walang ganon. Kasi, sometimes yung breakthrough talaga, or paghanap ng triggers, paghanap ng traumas, yung stressors niya, it will take time. Kaya sinasabi ko, hindi ka agad-agad mag-open up sa'yo Paunti-unti yan No? So, yung process na yon minsan abutin ng months. May iba years. May iba talaga, as in, the whole time, because of so much traumas na na-experience nila in their lifetime, kukulangin talaga yung buong another lifetime nila magkwento lang. Especially yung triggers nila is kasama lang sa family, which is really difficult. Kasi, syempre, kung ang family mo yung stressor mo, paano mo ba may iiwasan yun?
Ako nga, minsan kasama ko pa sa table
Oo.
Sabay tingin sa kanya.
And then yung isa naman din therapy, tinatawag din motivational enhancement therapy. No? Because ito yung tinatawag na kailangan mo i-push parati yung clients mo. Kasi sometimes, once na a client would see you, napapagod din yan. No? Sa middle part ng therapy nyo. They get burned out, they get frustrated. Kasi, syempre, hindi lang naman ito yung problem niya. May mga everyday life struggle siya. So, work, sa family, no? Sa pera and all. So, you need to keep on pushing him na do not stop. Because if they stop, then depression would eat them, weakness will eat them. So, mag-roll na yan. Dire-diretso na sila. Oo. So, it's difficult talaga. Kasi, it's like absorbing and then making them feel that they are safe. They have to have the strength talaga to go on day by day.
Well, Doc, I just wanted to ask then, in the context of especially our friends, people living with HIV, no? These kinds of therapies, kasi parang syempre kapag you're living with HIV, ang mga priority mo na is like, yung staying healthy, yung pagkain mo, you also spend for the meds, I don't know. So, parang last priority madalas nilalagay yung psychological and health because it also involves costs.
Yeah.
So is it costly or are there more cost efficient options for them?
Depende kasi talaga sa doctors, no? Sometimes if hindi naman kailangan ng they just need counseling lang, they go to a psychologist. But kung kailangan nila ng counseling with medication, especially if they feel like they have depression already, of anxieties, which is very common, no? For post patients talaga. Kasi, nandyan na no? Lalo pag bago pa lang Di ba alam na natin na stages? There's anger, no? Denial, anger, di ba? Bargaining, no? So, pag yun, nagtatakbo-takbo na yung lahat-lahat, mahirap talaga. So, kailangan minsan ng medication. So, pupunta sa psychiatrist. Medyo mahal lang ng konti. But, like I said,
250.
medyo mahal na konti, but kailangan lang talaga kasi sometimes hindi enough.
True.
Yung friend, hindi enough yung family, no? Because alam naman natin na depression, it's not just a feeling, it's a condition wherein there's chemical imbalances in your brain. So, you need the medication talaga to fix it.
It's anatomical na talaga.
It's in varying degrees.
Yes.
It's in varying
Yes.
degrees.
Hindi lang siya in your head talaga. Pero it's also
Nasa
good.
hair na din.
Oo, nasa bibig mo na.
At saka guys, di ba? I mean, hindi siya yung tama yung sinabi ni Doc JM kanina na hindi siya katulad ng ubo. You take cough syrup or something and then 7 days, 5 days. It's something that our brain, our mind is multifaceted. So we really need somebody like an expert who could actually help the person really manage, yung pinanggagalingan niya, yung kanyang isip, yung kanyang damdamin and everything.
Kasi for example, if you're a pediatrician, hanggang 18 lang lipat na sa internet Yung surgical operation, pag na-operahan mo lang, wala na. Ako, I have clients who's been with me for 12 years na. And I see them every month. 12 years na kayo magkakasama. Meron akong 3 client na gano'n. And I see them every day. So para kaming magkukumare na lang o kumpare, nag-uusap, no?
Okay.
Balitaan na lang o kumusta. Pati mga apo, alam ko na, kilala ko yung mga apo nila. Because that's how open we are. And which actually, that's yung kinakailangan talaga, yung openness to each other. Because para alam mo na he is telling you the truth. Yun ang importante. Yung truth talaga.
Pero Dok, kanina na-mention mo kanina yung motivational therapy, yung push, di ba? Kasi sa isang PLHIV, medyo sensitive kasi yung case din because hindi mo maiwawaglit sa isipan na minsan may mga suicidal tendencies din because of certain emotions, anger, denial, halo-halo na umiikot-ikot yung emotion niya. So, when is the best time for you to actually apply that kind of therapy na sinabi mo, the motivational type, the push for a person, especially for a PLHIV?
Okay, kasi sa amin kasi wala talaga tayo tinatawag na time frame. No?
Okay.
To each his own. Each individual kasi has its own time. Kung kailan niya sasabihin yung gusto niya o yung ano yung kailan siya mag-open up, no? Once na you see or you notice a telltale sign na this person needs help na talaga, especially pag kailangan niya ng gamot, no? If you feel like you see that he is undergoing depression, may mga anxieties na, no? That's why you start giving him medication, no? So once you do that, you always encourage him. Always give him the positive reinforcement talaga. Kasi a lot of clients, once they are suffering mga ganong problem na, puro negative thoughts talaga pumapasok sa kanila. True. There's always negative thoughts, overthinking, madalas yung ganyan hindi nakakatulog, isip na ng isip, kung ano na pumapasok sa isipan niya. Minsan, may mga tamang hinala na, no? Kasi nga, because of fears. Yes. So, once you notice na ganun pa lang, initially pa lang, magbigay ka na ng gamot. And you always tell them the basic principles of, yung basic steps of dealing with anxiety and depression, like yung breathing exercises, and kagaya sinasabi ko yung passive meditation, or yung self-awareness, importante din yun. And of course, yung positive reinforcement is really, really difficult to do at first, pero yun ang pinaka-importante talaga. Because whenever there's negative thoughts na papasok sa'yo, kailangan mo talaga ilabanan yan ng positive thoughts talaga.
Just a little backtrack lang regarding self-care. No?
I rewind na agad.
Oo. Hindi, syempre, because it's really really good to hear an expert opinion on this. Especially, parang self-care kasi like, for most people, probably people living with HIV, the first time na malaman nila, they have a tendency to probably self-sabotage kasi feeling nila they've let themselves down. So, it's hard to interject the idea of self-care. Mag-self-care ka. Ano ako magsa-self-care? Pusit nga ako. Diba? So, how do we bring them into convincing them that self-care is important and what can they do about it?
As I mentioned kanina, diba, dapat may safe space. And then let them feel na it's okay not to be okay. Ganun lang yon, no? Kasi minsan, tendency kasi pag Pilipino, pag nag-open up ka sa isang friend mo, kaya mo yan. Madali lang yan.
True.
Ano lang yan? Pray ka lang, ganun, okay lang yan, no?
Yes.
Which hindi mo dapat, because kailangan you make the person feel na okay lang na nahihirapan ka nga now. But it's just temporary. No? Because like I mentioned kanina, may mga stages talaga yan. Hindi mo pwede madaliin yung mga stages na yan because kailangan niyang intindihin, ipaprocess talaga kung ano yung meron siya.
Pinagdadaanan.
Pinagdadaan niya. Kasi kung hindi niya ipaprocess yan, mamadaliin natin, pipilitin natin, half-baked talaga. Tendency niyan, magkaka-relapse yan. Mapuputol yan sa treatment plan natin. Kasi walang commitment Hindi kusa yung pagbibigay sa kanya So, kailangan may commitment talaga. No? Tatlong steps yan. No? Pinakauna niyang step is yung tinatawag na, basta parang kailangan niya isabihin sa isang tao kung anong condition niya. No? Pangalawang step is in-depth exploration of the traumas, of yung anumang naramdaman niya. In-depth talaga, as in malalimang, seryosong pag-uusapan. No? Pangatlo is yung commitment to the treatment plan. Kasi that's very important. Kasi if you don't have that commitment to do the action, ikot-ikot lang yan siya. Iinom siya for 3 months, mawawala siya. For 6 months, inom na naman siya ulit. So, medyo difficult talaga. Yung commitment for the treatment talaga. To do the action. So, para sa akin, I do encourage sa mga friend na you need to listen. Talaga, muna. Huwag mo siyang i-push na madali lang yan o kaya lang yan. Kasi,
Like acknowledge them. They feel invalidated kasi for feeling bad.
True. Madalas yung ganung lengguwahe sa, I think, no? In general na, okay lang yan. Kaya mo lang yan. Dasal ka lang yan. Minsan, imbis na makatulong sa tao, parang nai-invalidate palalo. I think it's good to say that what you're feeling is valid.
Yes.
Tama, as part of establishing the safe space.
It's okay not to be
It's okay not to be
Diba?
okay.
Kasi,
Pero
talaga.
paano, another question lang siguro, no? What about for PLHIV or resistant to drugs? Yung ayaw niya munang mag-psych drugs or what? Because sasabihin niya, pambira, meron na akong ARV, dadagdagan mo pa ako ng droga.
Yun ang medyo
things like
mahirap
that. So,
talaga.
how do you handle those kind of situation?
You cannot really force someone.
Okay.
Oo. They just have to go through that process na sometimes kailangan talaga nila intindihin lang. Because you cannot force someone to take medication. Una-una, medyo mahal yung psych medication. Antidepressant, the mood stabilizing agents, sabi kahit anti-anxiety pills are medyo pricey talaga.
Yes.
No? So, you really can't force someone, but you keep on encouraging him lang. Just to encourage him, sabihin mo na these are actually safe, this actually can help you, but give it a try. Sabihin mo gano'n. If kung hindi mo gusto, but of course, you have to be very honest kasi sa maraming side effects talaga yung medication. No? Especially the first few weeks of taking it. May mga side effects talaga. So you have to be very honest na these are the things that you expect and what not to expect during taking the medication.
In the context of kasi syempre we have Jabar here, very proud living with HIV. And would like to ask, nung nalaman mo ba, did you also seek psych help nung nalaman mo? And what did you have to go through? And in the context, how did you apply the self-care?
Thank you very much, Eva. To be serious about it, I'm just fortunate that I'm a BS Psych grad also. And I'm a firm believer of therapies like this. And I'm I'm also a volunteer counselor. So I have this, I think I have that DNA already of how to go through it. Self-talk also, and I did also life coaching in the past, attending mga life coaching courses, and I think I'm fortunate to have those tools to be able to equip myself, during those times that it's really depressing. Guys, totoo, it's really depressing, especially if for an achiever like me na marami akong gustong ma-achieve sa buhay, go-getter, achiever, and sometimes, I really went to, I think, hindi man ako clinically na-diagnosed, but I think it was a very depressive 6 months for me. I went through it. And I think it's not just 6 months Minsan relapse din yan from time to time. I'm just blessed again and fortunate that I have friends, like si Doc JM and other expert who I go to also. Because I do believe, sabi nga diba in life coaching also at the same time, meron tayong dalawang resources. Meron tayong internal resource, ito yung mga values and virtues natin. And then meron tayong mga external resources, yan, katulad ng mga doctors, experts, families, friends, who could also... Intergalactic sources.
Yeah.
Parang sa moving Inside Out, may inside, may outside. So, it play everything nag-i-interplay lahat siya Eva, Viñas, and Doc. And yun, it's a journey, it's a process You cannot just say, I'm okay now or I've arrived. And me, I have episodes of anxieties, depressions. Isa siguro na mabisa na sa akin lang, na nakatulong. I love painting and drawing. So, finding your hobby, your interest.
Part ng self-care.
Yes, it allows me to manage my anxieties. Yun lang.
So what we can say is like your mental health talaga, your mental health journey is very unique to everyone. It's not the same for everyone.
Correct.
Pero it's okay not to be okay.
Iba-iba ang curriculum.
Yes.
Balik ang curriculum.
Yes, back to school tayo mga kaibigan.
Oh my God, ang dami ko natutunan, Doc, ha? Thank you so much sa pagbisita sa amin.
Yes! Thank you so much.
Thank you, Doc.
Thank you also.
Doc.
Thank you.
Thank you, Doc.
Sige.
Oh my God! Kahit ang lakas-lakas
God.
ng ulan sa labas, diba?
Ng ulan.
Ayan. Meron pa rin tayong makakasamang guest.
So pag isa lang yung source mo, sore lang.
Tapos bakit kailangan natin mag-spread ng tamang information? Kasi nagsasuffer yung people living with HIV because of stigma.